When we talk about medical issues, we usually start by talking about statistics.
But while that's important, in this instance, learning how to act fast is really what we want to hit home.
Teresa Price is a stroke program coordinator at Spectrum Health, and during Stroke Awareness Month, we wanted to talk about acting fast.
That's right. And let's start out, Teresa, by talking about what is stroke and what do you need to be aware of when we're talking about stroke?
Well, stroke is something that occurs about every 40 seconds in America. So every 40 seconds we have someone who has experienced a stroke. And we know that there are things that people can do to minimize the risk around stroke, which is one thing that we really would like to highlight to our community. The other thing that we like to teach people is something called FAST, and that's really when you recognize that you have a symptom around stroke, to act fast and to get to the hospital.
Okay, we have a graphic here that really breaks it down. Can we go
Yes.
with each point here, starting with our face and something very visual we could notice to really see if someone may be experiencing a stroke?
Right, so the three main elements that we want you to look at the person's face, and if their face looks like they're having some drooping on one side, you can ask them to smile. And if they don't look like they have an even smile, then they may be experiencing a stroke. A is for arms. We ask people to put their arms out. So if you're with somebody and you're wondering if they're having a stroke, ask them to put their arms out. And if one arm droops down or starts to fall down, then that's also potentially a sign that the patient is experiencing a stroke. And then speech. You want to ask the person to repeat a simple phrase, just any phrase, just a simple phrase. If it doesn't come out right, or if they don't respond to you in the right way and it sounds slurred, that also is a sign of a stroke. So if any one of these signs are present, the person may be experiencing a stroke, and the correct thing to do is to call 911. When a patient comes in via EMS by calling 911, the stroke response team is already activated at the hospital. If you try to drive in yourself, there are other risk factors around safety,
Right.
but we also aren't aware that you're coming in, and you may sit in the emergency room waiting to be triaged. So the treatment really starts by calling 911.
Yeah, absolutely. When we talk about risk factors, you always kind of wonder, are there things that we can do maybe to help minimize our chance for having a stroke?
Yes, definitely. We have modifiable and non-modifiable risk factors. Your genetics around your race and your age, your gender, those things you really can't modify. But things that you can modify are hypertension. Hypertension is the leading cause of stroke in America, and we know that by decreasing your blood pressure to an appropriate level, that you really significantly decrease your risk for stroke. So collaborating with your primary care physician and understanding your high blood pressure, understanding your cholesterol levels, making sure that you know your glucose level, and knowing if you're diabetic or at risk for diabetes, those are all things that can decrease your risk for stroke.
Yeah, you have a great tool that people can use also. You have
Yes.
a website, and it has a lot of information on it, and it also talks about the screening process and what people need to do to be able to take advantage of that. We're looking at the website right now, and some of the things that you can find out by clicking, on this.
Yes, so we have a website, and you can actually take this online assessment, and it will give you your risk factors, and it will give you some ideas about things that you can talk about with your primary care physician on how to decrease your risk for stroke. And it takes about 5 minutes to complete or less. I did it again last night, and it took me maybe 3 minutes to go through it, although I had went through it before. So we encourage the community to go to our website and to go through this assessment tool, and then to bring it in and to share the findings with their primary care physician and determine, if there's something they need to do or something they can do to decrease the risk.
Well, and that's a great tool for someone who may have computer access, who may be able to go online. But you also have a series of free screenings where people can come and interact with your expert team to see what their risk actually is.
Yes, we're very proud of this. For the last 4 to 5 years, our neuroscience nurses have been conducting blood pressure and stroke risk screening on our actual sites at Butterworth and Blodgett Hospital. We're even more excited this year. We've expanded it to all of our Spectrum Health sites. And so either our employees or people coming into the hospital. You don't have to be coming in to visit. You can come in just for the blood pressure screening. It's a free screening. We take your blood pressure, we do the stroke risk assessment, and we provide you some direction on what you need to do based on the assessment. And again, that can be brought back to your primary care physician. There's no registration that's required, and it's free of charge to the community. And again, it's our neuroscience nurses, and we're very proud of them. They're proud of helping the community and participating in that way.
Well, thank you for coming on and sharing the information.
Thank you so much.
Stroke Awareness Month, it's a great time to really get assessed and look hard at your own risk, or perhaps the risk of the people around you that you care for.
Yes.
Yeah.
Thank you very much.
Thank you so much for having me.
We'll be right back.
This is 8 West.